So hello everyone. Hi guys. So guys, on today I'm coming back. I want to talk to you about the melanoma and how I'm dealing with figuring out exactly what I'm going to do. This is part 2 of me talking about my first visit to the PA, because you see a PA first, you don't really see the doctor, but he's a neurologist in training. So I went to that was my second appointment, which was 2 weeks after I was diagnosed with the melanoma. So I'm just gonna let you see some of the paperwork they send you home with. This is some of the paperwork, and I'm just gonna read off about what I have, because there's so many different things that I can't pronounce or whatever. So I just want to give you a little information about a melanoma. Although melanomas are considered to be a type of primary brain tumor, they do not grow from brain tissue itself, but instead arise from meninges, 3 thin layers of tissue covering the brain and spinal cord. These tumors are most commonly grow inward, causing pressure on the brain or spinal cord, but they may also grow outward toward the skull, causing it to thicken. Most melanomas are benign, which means they're slow-growing tumors. And most meninges are benign, slow-growing tumors. Some contain sacs, calcification, or other things. But there are several different ones. But today I'm just talking about the one I have, which is the brain tumor melanoma, which is benign. I don't want to read all that out, but I just wanted to give you a little information on what a melanoma is. I'm still learning about it. And so some of the causes of melanomas, although the exact cause is not known, it has been associated with radiation exposure. The most described genetic alteration is the loss of chromosome 22, normally involved in suppressing tumor growth. It is seen in approximately 50% of patients with mutations or neurofibromatosis. So guys, I'm not going to get into that. Meninges are also frequently have extra copies of the platelet derived from growth factors. And these are some of the causes: obesity, high blood, high body mass index, a history of breast cancer, head trauma, or cell phone use may be risk factors for developing melanomas, but the evidence is not inclusive. Some melanomas have receptors that interact with the sex hormones such as progesterone and estrogen. But I'm not going to that. But I just wanted to let you know some of the causes. And melanomas account for about 1/3 of all primary brain tumors. They are most likely to be diagnosed in adults older than 60 years of age, and the incidence appears to increase with age. Melanomas are rarely found in children, and they occur about twice as often in women than in men. So this is like melanomas occur in men, but not as often as they occur with women. So guys, this is part 2 of it. I'm just trying to, let people know about what I am going through with having the melanoma, how I'm making some decision as to what I want to do, because I can leave the melanoma alone and just see what happens. But in leaving it alone, there are some risk factors, which means it can continue to grow and get bigger and press more on my brain, which I know, guys, this is a lot. And then the other thing is having this surgery to remove the melanoma and take the pressure off the brain, because that way I won't have the symptoms like, I won't have like the symptoms, which is seizures. That's one of the biggest symptoms that you have with the seizures, headaches, and loss of being able to, you won't be able to use whichever side it is the way you need to be able to use it. You lose strength. So that's what they check for when you go to the doctor. On my second visit, I met with the PA, which is a physician. The PA, which is the doctor's, one of his people that he works with. And you see the doctor after you kind of make your decision, and the doctor kind of tells you exactly what's going on. But in this video, I'm not going to talk about that. I'm just going to talk about my second visit and when I went on my second visit. what type of decisions I am making concerning it. So guys, I have decided, because my melanoma, or the brain tumor on that I have, is not small. It's a medium size, and it can continue to grow. So I made the decision to go ahead and have it taken out, and I will be having surgery. And I'll have surgery. I'm going to the doctor so that I can discuss going ahead and scheduling for the surgery. So I have decided that I want to have the surgery so that I can have it removed and be the best me I can be. This decision was very hard for me, because when I first went in and found out I had it, I was really freaking out, guys. I was like, you know, what am I going to do? How am I going to handle this? What does my life look like now? Because anytime you have something done and you're talking about your brain, or it's a lot, and you got to make some decisions. And for me, I had really talked to family members. I talked to a lot of my friends. I don't have a lot of friends, but the friends I did talk to, they really encouraged me. It was like, technology is so different than what it used to be. So they were like, you're going to be fine. Technology is not like it was before. So you should be able to go in. And I was glad I talked to other people. And I talked to one of my friends that she had cancer. And she was like, Karen, go ahead and just get it out, because you don't know what can happen. And I talked to some of my older friends and family members. And because on the day that I was diagnosed, guys, I literally freaked out. I didn't know what to look forward to. Even though I had talked to the surgeon who's going to do the surgery, I had talked to him. I didn't realize he was a surgeon. I didn't know, too much about it. I was just in a daze, guys. But I had to kind of regroup and get myself together, because I was like, I'm not taking medication. I'm not gonna have surgery, because my surgery is my brain. And I'm like, that's my brain. I don't want anything done to that. I don't want anything to alter it. So many things rush through your mind, and that's why I wanted to come on and talk about it. So many things were going through my mind, and so many things are still going through my mind as to how I'll be after surgery. So that's the biggest thing for me. But, you have so many people that come on and go, oh my God, a lot of people have the surgery. It's not that serious, but for me, I feel like it's serious to me. It's my brain, and it's how I function. And I was asking questions like, will I be like the same me when I come out of the surgery? So that's the things I kind of worry about. I mean, I am the head of my household. I have a spouse, he's the head. But, when you're in your home and you're used to doing things, and, you don't know, and you're trying to figure out. And for the biggest thing I want to tell people was, the hardest thing for me was, and I have to breathe as I'm talking because I get a little teary-eyed and I don't want to be crying through my video. But the hardest thing for me was knowing that I have a special needs child, knowing that I have some children with some mental issues going on, and how are they going to react to the situation. And then looking at my husband, thinking about how he's going to feel. So, I'm concerned about those things, and family members, because I chose not to tell all of my family. I just chose to tell my siblings, and I've told a few people in my husband's family about what's going on. But I chose not to tell a lot of family members, because I don't want them to get worried, anxious, and you don't really want to hear anything negative when you are when you are having things going on with your body. You want to be around people that are positive. And for me, I thank God I was doing the positive thinking. I was staying positive. But guys, this was something that hit me out of nowhere, and trying to deal with it has been very hard, because I'm making decisions about something that's going to affect me the rest of my life. It's not easy, but I did make the decision on that day to have the surgery. And I'm going to go ahead and get the surgery done so that I can be the best me I can be. Of course, I'm worried about a lot of things, but I'm learning to put things in God's hand. It's not easy, guys. I cry a lot. I am just very emotional, and I'm trying to get past the emotional part, because in the emotional part, people don't want to tell you, people say, oh, just, I'm trusting God with whatever happens. And I know that God designed all this technology, and he gave doctors the knowledge so that it can help us. But still on the back burner, you're thinking about it's my brain. It's my brain. For me, it keeps saying it's my brain. And, you know, I keep asking myself, am I going to be okay? I talk with my children more, you know, and I tell them how I feel, you know, and some days I don't feel the best. And like on yesterday, I had like a rough patch, but I'm just trusting God and going through the procedure and just trying to deal with that and just deal with what's going on. It hasn't been easy, but I want to let people know, you know, you can get through it, but I'm just having some things going on with me in my mind where I'm worrying a little bit. And I want to be honest and tell you guys, it hasn't been an easy journey so far. That's what I want to talk about. So while I was there, because I'm deciding to have the surgery, I have been ordered to have a lot of like MRIs, and I have to go on different machines for the MRI. And as I told you in the last video, I had an MRI done at the hospital, and I was in there like 35 minutes, and I was like, it was not working. And so I ended up coming out of it. I was able to get that done. But once I went to the doctor and the PA, and he's told me I had to have, you know, a lot of scans done before I could see the doctor. So they told me, he was telling me, I said, I don't know how I'm going to do back in the MRI because the last one was really rough. So he was telling me, oh, don't worry, we'll give you something to calm you before you go in. So guys, I did go in and have like a lot of scans done and an MRI so far. And I may pick up some pictures because I did have some pictures when I went in and had the MRI. And they gave me something to take to calm me down, and I took it about 30 minutes before going in, and it really calmed me down and put me to sleep more so it was a lot better. And that I had to have like an MRI with contrast and without contrast, and they call it like a CyberKnife thing where they can see the different areas of your brain. So I had to have that done, and I had that one done with and without contrast. And for me, guys, it's kind of weird because also I wanted to let you know I have issues with getting my blood taken. So when I went in to have it, they were having problems trying to get my blood, because you have to put a needle in so that you can have the contrast put in. So my veins tend to die a little bit, a lot. So they have to have like a special person come in and do mine. That's another thing. And also, guys, I had to go to another place and have a different type of MRI done, and that was maybe a 10-minute MRI. So I'm being just sent to have different things done so they can prepare for this surgery. And I just want to go ahead and get the surgery and come out of the surgery and feel better and get back to doing all the things I want to do. You know, like I garden and I like to do DIY projects and clean. So I'm trying to see how that's going to look, how long the time, I'll tell you in the next video, how long I'll be down, how long I'll be down and how long I may be off of the YouTube for a while, because I have to recuperate after having the surgery. So I'm not gonna make the video much longer. I just wanna come in and talk to you about that, guys. I'm feeling a lot better, but I have my days, and I wanna be honest with you, because anytime you're having something done, like I'm getting ready to have done, it is major to you. Even though people say it's a simple surgery, I just don't believe any surgeries are simple. But I thank God I have my therapist. I'm able to talk with her, and I have the paperwork and stuff like that, explaining everything. And guys, I did go on Google before I even went to the doctor, because I wanted to see what it was like to and find out some information so that I can write things down and be able to ask questions when I went to the doctor. And so far, guys, I'm doing okay. I want you guys to know that. I just want you to know to keep me in your prayers, guys. And I'm gonna do a part 3, which means once I go to the doctor, the surgeon who's gonna do this surgery, that's gonna be part 3, and I'll tell you guys all about that. But guys, thanks for listening in and checking me out, and just keep me in your prayers, guys, as I continue to keep you in my prayers. And just know I'm gonna get through this, and I'm gonna be back on social media. So guys, you have a great one. Thanks for coming in. This is just part 2 of talking about the surgery and how things are going, okay? So I'll see you in the next one, guys. Don't forget to like, share, hit that notification bell, so each time I upload a video, guys, you can see. Have a great one. Bye-bye. Guys, this is one of the videos. I just wanted to do a quick MRI day. And don't mind my hair, because I got it loose, because I'm having an MRI with and without contrast. So this is the way I'm looking for one of the MRI visits, guys. Starting off, getting ready for surgery. So yes, guys, it's MRI day. So I'm getting ready to have my MRI done with and without contrast. These are some of the procedures you will have to do before you can have the surgery. I've been doing a lot of MRIs and CAT scans and other things. So this is the second visit, but to a different place to have the MRI done. So I'm at radiology and imaging, and they're doing that, and I'm gonna get ready to go in for an MRI. So guys, thank you. I'm trying to document some of the things I'm having done before the surgery. So I'm out. I've had my MRI, guys. So for me, they can never, ever, I have terrible veins. So I would get stuck quite a few times when I'm in the hospital or getting things done. So I had MRI with and without contrast, which is what my doctor ordered. All right, guys, I'm just noting this. And today is March 24th.